Hello, my name is Dr. Terry Chappell, and I'm a physician in Bluffton, Ohio, a family physician. And one of the things that we deal with is pain. Pain is one of the most common symptoms that patients come into the office about. And unfortunately, conventional medicine doesn't do real well with pain. We do have pain pills, we have antidepressants that are used, and those are the main treatments other than surgery, which is sometimes used, such as replacing joints or other types of surgery for pain. Um, we find that those treatments are not satisfactory, mainly because of the side effects. You can get addicted to narcotic medications, and most of the pain medications that are used are non-steroidal anti-inflammatory drugs. And the problem is that they can cause side effects. It can affect your kidneys. It can give you a stomach ulcer. It can increase the risk of heart disease. Uh, any of those drugs can affect you in that way. So we look for natural treatments for pain relief. And I think we've been very successful because we've been searching worldwide over the last 30 years trying to find ways that are safe and effective. In the first place, there are quite a few nutritional supplements that you can take that can reduce inflammation, which can help pain. Glucosamine sulfate is one example. Turmeric or curcumin is another example. And there's a lot of combinations of herbal preparations and nutritional supplements that can reduce inflammation and help pain. Another treatment that we have done pretty extensively over the last 20 years is prolotherapy. Now, a lot of pain originates in the joints. This can be in back pain, it can be neck pain, it can be in the hip, in the knee, in the elbow, and the shoulder, and just about any joint in the body. And the reason you have pain in the joints is usually an instability of the ligaments. The ligaments get torn or they get stretched or from overuse, and they don't hold the bones in place like they're supposed to go through the usual range of motion. Now when that happens, that causes an instability which results in inflammation, and that leads to arthritis. And then you can see spurs, you can see calcium deposits being laid down around the joint to make it so that the joint doesn't move as readily and cause further inflammation. And the only trouble is it can stop the pain eventually over the years, but then you can't move the joint, so it's not a very functional result. So what we do with prolotherapy is we inject a small substance, mostly natural substances. A sugar solution is used frequently, and you inject this where the ligaments attach to the bone. And the body thinks that this is irritation that results is a new injury, so it sends out repair cells. The repair cells are called fibroblasts. If you do this repeatedly, maybe 13 times, sometimes less, sometimes more, over a period of time, the body responds to that by sending out these fibroblasts that lay down new ligament tissue, and the ligaments get stronger and they get thicker, and they actually hold the bones in place for their normal range of motion. Now this is a long-term benefit because if this works for you, which it usually does in most patients, then you have a lasting result that may go on for many years, sometimes for the rest of your life. This treatment is taught at University of Wisconsin and UCLA medical schools, but is still considered an alternative treatment. Another treatment that we use quite a bit is acupuncture. Now that's been around for about 5,000 years, so I think they finally got it pretty well established. But we still don't know exactly why acupuncture works. But they're tiny needles, there's no injections involved, and they're put around the area of concern. And then they're also oftentimes put in other areas of the body, particularly on the ear, for example. There are acupuncture points that correspond to every part of the body. So we use acupuncture. We use laser treatments a lot of times. Now, laser increases the circulation, reduces inflammation around joints. So many times laser therapy can be very effective for headaches and for other areas of pain. Another treatment that we do is an amazing treatment called pain neutralization technique. And this was developed by a chiropractor, Dr. Stephen Kaufman, out in Denver, Colorado. And I've trained personally under him several times. And what you can do with PNT is you can move the tissues softly with your fingers, not right at the point of pain or trigger point of pain, but around it in some fashion. And that sends signals up to the spinal cord that neutralizes pain messages. And sometimes if you do this, pain that's been there for many years can go away with even a single treatment. But most often we do 4 or 5 treatments. And then if you do it that many times, the body gets the message that it kind of reprograms itself so that that pain message is neutralized. So it's a really amazing treatment that we use quite a bit. So we feature natural approaches to pain. And one of the favorite things that we see are people that have been in pain for years, they get long-lasting relief. So once again, if you're interested, we are very happy to see you at Celebration Health Association.